Today the topic is Norma basalis. Basalis meaning the base of the skull. For our convenience, we have divided the Norma basalis into three parts: anterior 1/3, middle 1/3 and the posterior 1/3. First, we are discussing the anterior 1/3 of the Norma basalis. The bones in the anterior 1/3 is the palatine process of maxilla bone. These are the alveolar sockets of maxilla bone, and underneath the maxilla bone is the horizontal process of the palatine bone. The sutures which unite these bones are between the two maxilla bones, this is the intermaxillary suture, and between the two palatine bones, this is the interpalatine suture. Between the maxilla and the palatine bone, there is a horizontal suture, that is the palatomaxillary suture. This forms a cruciform suture. The foramens and canals in anterior 1/3 is number 1, the incisive canal, this one. And these are two canals. There is the greater palatine foramen, this larger one, and below this, these are 2 to 3 lesser palatine foramens. This projection is the posterior nasal spine, and these are the palatine crust. Now moving forwards to the middle 1/3, the bones in it are this is the palatine bone inside, and this is the vomer bone. This is the pterygoid processes of palatine bone, sphenoid bone, greater wing of sphenoid, and this is the broad bone bar which is formed by the sphenoid bone, body of sphenoid, and some part of the occipital bone. Moving forwards, if we see the canals and foramens in it, the vomer bone, superiorly it unites with the palatine, and inferiorly it is divided into two elas. The foramen that is enclosed between the ela of the vomer and this is the vaginal process is known as the vomerovaginal canal, this one. And these are the pterygoid plates. This one is the medial pterygoid plate and this one is the lateral pterygoid plate. The fossa that is enclosed between is the pterygoid fossa. Beneath this pterygoid fossa, the medial pterygoid plate encloses a triangular area that is known as the scaphoid fossa. The medial pterygoid blade downwards, it is continuous with the palatine bone. There are two canals here that are known as the palatovaginal canals. If we move forward, this one is the foramen lacerum, this one is the foramen ovale, and this small one is the foramen spinosum. Downwards, this is the carotid canal, and beneath this one is the jugular foramen. Now moving forwards, we see the posterior 1/3. In this, there is the bony end of the bony bar. These are the occipital condyles that are ellipsoid in shape. This foramen is the foramen magnum. There are two canals, anterior and posterior to these condyles. This one is the anterior condylar canals. This is also known as the hypoglossal canal because the hypoglossal nerve passes from it. And this one is the posterior condylar canals. On this side, this is the mastoid process. This is the mastoid process, and this projection is the styloid process. The foramen enclosed in between these two is the stylomastoid foramen for the facial nerve. And the other thing, the left thing was this is the external acoustic meatus for the hearing.